Our next speaker is frequently chosen as one of the best doctors in America since 2004. In 2006, he was featured on the cover of Chicago magazine as Chicago's top doctor and was selected as NBA Team Physician of the Year in 2009. He's the head team physician for the Chicago Bulls NBA team, co-team physician for the Chicago White Sox MLB team, past president of the American Arthroscopy Society AANA, and founding president of the On Foundation. There's only one person with around 1,000 publications and 10 widely read textbooks in orthopedics and regenerative medicine, and countless awards and podium talks: Brian Cole. He might be best described as the Chicago Bull of orthopedics or Mr. Efficiency. He will share his lessons learned during his career and make you think about yours. Please welcome on stage Brian Cole.
This is not a scientific lecture on orthopedic regeneration, but rather maybe a more personal discussion on personal regeneration. In some ways, the things that I think about are somewhat agnostic to specialty or what you do as a career, and this desire to achieve balance in profession, family, and the workplace, while aspirational, is something that we all try to achieve in each of the activities that we do on a daily basis. And to sort of figure out where we've been and how we've come to this point, I think that discussions on epiphanies of a busy surgeon sort of lead to these findings that I myself have discovered over time. Pictures tell an amazing story. If you have the opportunity to go back and look at old pictures of yourselves and see what's happened over time and how things have transcended, I think you get a very good sense of where you were and where you are today. I look back circa 2004, and I would much prefer to be where I am 2020, thinking how at that time I was particularly out of balance. Achieving balance in life and the workplace is probably one of the biggest challenges that each of us face on a daily basis. And I often liken it to the concept that work is like having a ball. You drop it, and it bounces back. Many of us have experienced that. Alternatively, like a glass, family, health, spirit, friends. Once dropped, it shatters, and it's irreversible. So achieving balance is one of the biggest challenges we have, but it has a meaningful outcome once we spend the time to do so. And I've often thought of this as sort of an allegorical home. In a home, we build a foundation that creates something that's sustainable. We then frame it along the way, and then we put its final touches on the ultimate home. But the foundation is probably the most important aspect of this. The foundation is what everything else is built upon. It's what creates sustainability. So I'll tell you a little about myself and some personal things to sort of set the stage to a number of epiphanies, if you will, that transcend my medical knowledge. These are my parents. My parents were married for 65 years. My mother passed last year peacefully at the age of 84. My father's still very healthy, very active. And when I think back about how this relates to my own personal foundation, I think about the things that I was exposed to when I was younger. And I was very fortunate to have a very loving, unconditional environment. And the things that I did with my own parents, such as skiing and sailing and competitive sports, are the same things that I do today with my children. Those role models, that experience, is really what led to much of who I am today. That's the initiation of our foundation. And then there's your primary family, which is also a critical component. My wife providing unconditional support to allow me to sustain the satisfaction and the goodness that comes from having a career and helping to take care of others. And also our children. This is Ethan, Adam, and Ava. Providing unconditional support for our children. This is a recent quote from one of my mentors who passed, Freddie Fu, who says, look, our children are individuals who we provide unconditional support for. And just like our patients, they come back to us in years to come with strength and gratitude. And then part of that foundation is those around us. We surround ourselves with greatness that's better than you and I alone. So on the left is an example of my staff. My staff is incredibly loyal, incredibly dedicated. People who I make sure to thank each and every day and to make sure that they feel valued. And on the right is just 1/3 of our practice of just the sports medicine physicians. We've been very blessed. In my program in Chicago, we've trained over 100 sports medicine orthopedic surgeons over 35 primary care sports medicine physicians, and 10 shoulder and elbow physicians. These are the future leaders of our societies. These specific individuals, 60% of them are now in academics. Many of them take care of professional teams, and many of them are program chairs. By leading with example, we're creating the next generation of physicians. And then we get to the framing of our allegorical home. So we've established the foundation. So we move along and we frame, right? So this is what Benjamin Franklin said. Look, if you want something done right, give it to a busy person. Those of you who are very competent and efficient at what you do, you often get asked to do something, and then you ask to do something again. And one of the original sins is being asked to do something and then not delivering. So what I've learned personally is that when I accept the new tasks, it's sort of a horizontal integration rather than vertical. Horizontal meaning it borrows from something that I'm doing each and every day, rather than an entirely new task that I have to build upon with a new skill set. And that allows me to be reliable and responsive. But it's difficult to say no. No is a complete sentence. And every time you say yes, you are saying no to something else. I can tell you as a healthcare professional in academic medicine, one of the biggest challenges is saying no because of the feedback loop that we live in each and every single day with our patients and our peers that validates who we are. It's somewhat addictive, it's infectious, and it leads to our inability to say no at the proper time. So now when I try to say no, which I do frequently, it's an issue of balance. It's, will it lead to something better in my career? Will it take me otherwise out of balance with my family and my friends? And each decision to say yes or no is weighed essentially on those principles. Each of us have been affected by the pandemic over the last 18 months, and we all have our own very personal memories about this pandemic. It's amazing how a political narrative has shaped medical decision-making. I think back, like that picture on the right, where I was washing my groceries in bathroom cleaner, treating it like a surgical experience just to get some food in my system. All of us had some of these just crazy habits because we had such poor information. And then we've also been affected by those around us. Many of you have lost loved ones. Many of you have been afflicted with this. Some of you may have permanent symptoms that are still remaining. The best thing is the fact that we have a vaccination, and that's changed the world. And I hope each and every one of you who's listening has had a vaccination for that purpose. But it was a strange time. It offered the opportunity to spend time with our families. We had these daily testing kits, which were very unreliable, but gave us this false sense of satisfaction that maybe we were disease-free to protect our families and our friends at that particular moment. We drank lots of wine. We played lots of games. In fact, we had so much difficulty keeping up with the wine that we turned to boxed wine, which is actually pretty inexpensive and did the job. I encourage you to try it at some time. And while many Americans were out buying Pelotons for fitness, in my home, my 2 children went out and found a dog, probably the most inappropriate dog you could have for a family, a very busy family, a border collie. Not the best choice, but he is wonderful. But during that time off that each of us as clinicians had, the 3 months where I did not see patients or do surgery or make clinical decisions, we all kind of learned something. We learned what our core is. We learned the satisfaction, it reiterated the satisfaction that we have each day when we see and treat patients, the gratification and the fulfillment that comes from taking care of people. That was lost over that time period as we were buckling down, trying to keep things in check. It was a very strange and difficult time, but what it did do is it reinforced our values as physicians, as clinicians, and the privilege that it is to actually take care of people and make a difference. And then it's the final touches on our home, and what does it all mean? I would tell you that I'm clearly way more comfortable talking about original science and scientific papers and concepts of decision-making than I am sharing personal epiphanies, if you will. But I was able to synthesize it down to sort of 10 points that transcend my own personal medical knowledge. And the first one is managing time. Managing time is still one of our most difficult issues. We pay for things in time, not money. How do we do this responsibly? Well, I think in part it relates to surrounding ourselves with people that are better than our own. It also relates to responsible delegation and understanding the needs of those around us. Are we fulfilling their needs, their obligations? How do we best manage our time? The words of Warren Buffett are particularly interesting to me. The interesting thing about business, he said, is that it's not like the Olympics. You don't get any extra points for the fact that something's very hard to do. So you might as well just jump over 1-foot bars instead of trying to jump over 7-foot ones. And a squirrel once told me, be decisive, right or wrong, make a decision. The road of life is paved with flat squirrels who couldn't make a decision. Decision making is tough for all of us in any setting that we work in. And we're striving for excellence, but all the while we're challenged by perfection versus efficiency. Colin Powell said, look, if you have between a 40 and 70% chance of getting it right, of making a decision, make the decision. If you're looking for 100%, if you're looking for perfection, you're wasting time. And if you make it quickly, say you have a 20% chance of success, it's associated with shoddy work and the lack of excellence. And then it's all about seeking out mentors. Having the privilege to train lots of young people, I always say, look, you're going to have the opportunity to experience a deep dive into each of us, our lives as clinicians in our office. And you don't have to emulate every character trait, but rather pick one or two. It's sort of like life's menu, life's smorgasbord, if you will, of character traits. And you can pick one or two of them and ignore the rest if you wish. And all of that can be a mentoring model that leads to how you differentiate yourself as you progress through your career, your life, or your job. Having the privilege to take care of professional athletes is associated with a lot of issues in decision making. And one of the things that I learned all along is that while it can be particularly provocative to befriend an athlete, our boundaries have to be maintained because at some point they're going to need us. And if we blur the distinction between friendship and professionalism, it can be very difficult to earn the confidence from that particular individual. It's a lot like raising children. Trying to be too good of a friend compromises our ability to do so in an effective way. It's the same thing when we're managing professional athletes. There's a boundary there, as appealing as it might be to get to know them personally, which I encourage to encourage trust. There is a boundary to maintain that differentiation to be successful when it comes time when they really need us most. To be a good leader, put yourself in others' shoes. It was Mark Twain who said, really great people make others feel that they too can be great. It was also Colin Powell who said, if you want to test a man's character, make him a leader and see how he performs. The military has some great examples about leadership. Colin Powell professed that being a leader sometimes means pissing people off. Build consensus with preemptive communication, calling someone ahead of time when you have a difficult issue rather than serial emails. Sort it out. When you have to build consensus in a room, start out individual by individual. The day the team that you lead stops bringing you their problems is the day that you stopped leading them. Look below the surface, even if you are afraid of what you might find. Never let your ego get so close to your position that when your position goes, so does your ego. Great leaders are also great simplifiers. And surround yourself with people who take their work seriously, but not themselves. And above all, have fun as a leader. And finally, if you are successful, you will be criticized. And this is one of the most challenging aspects of being in a position of leadership that I've found. What I've learned to do is say, look, there might be a grain of truth in this. We can make changes and improve for the future. Number 6, be a good listener. This is one of the most challenging things we do as physicians. In fact, it's been calculated that it takes about 7 seconds as a physician to interrupt your patient while he or she is actually trying to describe their problems. 7 seconds. I've learned that patients have concerns, and they come to us for that main reason. And just sitting, listening, asking the proper questions doesn't take a lot of time, but doing it effectively, compassionately, thoroughly, can make the entire office visit achieve the goals of that patient and allow them to get the outcome that they deserve. Being a good listener is not something we know out of the gates, but it's something we learn over time with feedback. And related to this is our society's preoccupation with technology. This is a wonderful editorial written by Lisa Rosenbaum. And the premise of this editorial was that we tend to focus on technology over reason. Patients place this emphasis, for example, on getting an MRI rather than actually sitting, listening, asking the questions, identifying what our patients really want. I've never known a patient who actually felt better after getting out of the MRI scanner. Unfortunately, there's this preoccupation with doing so. And it relates to this wonderful quote by Voltaire, who discusses The Art of Medicine. He says, the art of medicine consists in amusing the patient while nature cures the disease. This is, to me, one of the most potent tenets in managing patients. There's a tremendous amount of satisfaction with knowing the natural history of disease and knowing that most of it can be skillfully neglected over time as long as you understand that natural history. Certainly skillfully neglected without surgery. Number 4, take off the blinders. I know when I've been faced with very difficult challenges that I tend to be head down, not looking left, not looking right, which alienates those around you, which creates a lack of loyalty and buy-in. Mercedes Lackey said it well, once the blinders are off, it's very hard to go back to seeing the things the way they used to be. Number 3, showing gratitude. This is something that I learned a long time ago, and I'll share a story. There was a wonderful episode on NPR. It was a kindergarten teacher who was 85 years of age, and one of her former students, who was in his 60s, stumbled upon her and said, look, I remember you as my kindergarten teacher. You were the best teacher that I ever had. And she welled up with tears, and she said, nobody in my entire career ever complimented me or told me that I made an impact on their lives. Gratitude is time sensitive. If you think it, there's no time like the present to say it. I recently calculated that if a patient undergoes an ACL reconstruction, 32 people have some place in the care and treatment of that individual from the time they injure themselves on the court or the field to the time that they're released to their sport. 32 people are involved. And I'm sure I've missed a few in that count. But recognizing these individuals who are participating in their care, from my perspective, when I play a very small role with just a simple surgery, is critically important because it ultimately leads to the benefit of the care we deliver to our patients, showing gratitude. Humility. This is C.S. Lewis who said, humility is not caring less about yourself, but caring about yourself less. Humility is not something we're born with, but it's something we earn over time. Those of you who have had the opportunity to meet people who are faced with big challenges at any point in their life, you often come to recognize that they are far better prepared to deal with life challenges than they otherwise would be. I was pretty blessed for a long time until I had any difficult life challenges. I would tell you in my early 40s, my family was faced with 2 particular challenges that I was not well prepared to deal with, mainly because I didn't have life experiences to share from when I was much younger. But through that progression, I learned humility. And I learned a sense of self-awareness that still works for me each and every day. Learning humility can actually be quite painful, but the end result is a resounding sense of being more effective in how you manage others and how you manage yourself through our life challenges. And then finally, it's family and friends that matter most. It's not the stuff that we have, it's our shared experiences that have shown to be the highest level of beneficial behavior, that leads to the highest beneficial behavior in a sense of well-being. Economic philosophers often talk about this utility curve of happiness and money, and it's interesting. $1 really has the same utility as $250 million, right? Each dollar has the same buying power. But when it comes to happiness, there's a progression that asymptotes. And in fact, you can be a bit happier with each dollar. But what philosophers and economists have taught us is that it asymptotes somewhere around $75,000. In other words, the marginal happiness that we get beyond this point is not particularly meaningful. It's the shared experiences, not the stuff, that seems to be grounded in our happiness. And as I mentioned, we don't buy things with money, we buy things with time. And in the end, it's often said that time is wasted on the youth. Learning this sooner than later, and this is something I try to teach to my own children, can hopefully serve them in good stead as they age. Barbara Fredrickson said that our immune systems are forward-thinking. Shared experiences are what creates a very powerful, strong immune system. So friends, family, sharing things such as this are the things that lead to a more profound immune system and to greater happiness and health as we age. So thank you, and enjoy every day of work and life.